Assalamualaikum warahmatullahi wabarakatuh. Hello, students. How are you there? I hope that you are getting fine there. And here we are going to continue our online class, namely meeting two ethical dilemmas. After in the last meeting, we have completed about nursing ethics. So what is the ethical dilemma? Ethical dilemma, it is a problem without a satisfactory resolution. So there is no word right or wrong decision. Here, the most common ethical dilemmas in nursing practice, at least we provide five things. The first one is pro-choice versus pro-life, freedom versus control, truth-telling versus deception, empirical knowledge versus personal beliefs, and the last one, resources management. Now we open up pro-choice versus pro-life. This issue affects nurses personally. Many of the position nurses assume in this dilemma are influenced by their own beliefs and values. Take an example. How does a nurse care for a patient who has had an abortion when the nurse himself consider abortion murder? And then, can that nurse with the very opposing values support the patient's right to choose her autonomy? Yeah, sometimes it's dilemmatic. And then, now we go to the second one, namely freedom versus control. It relates to the issue, which is closely related to the patient's right to make choice for him or herself, and the nurse's duty to do the best for the patient's health. Take an example, patients want to stop eating, but the nurse knows that the consequences will harm the patient. Does the nurse have the right for the patient to eat? Then the next is truth telling versus deception. This relates with another issue that the nurse may have to deal with, especially when the families want to deny telling the patient the truth about the medical condition. Here, the example is what should a nurse do when a family insists telling the patient the diagnosis will cause harm? How can a nurse know if this is true? Does the patient have the right to know? Next, empirical knowledge versus personal beliefs. It relates to what is science based. Empirical knowledge to a nurse might be completely subjective to a patient with a particular set of religious or personal beliefs. Certain religions forbid medical procedures, which can mean the difference between life and death. The example says, what should a nurse do when a patient is admitted to the hospital that desperately need a transfusion to live, but has the belief that transfusions are unacceptable? The nurse knows this patient will die without the transfusion. So it's completely dilemmatic. Okay, the dilemmatic issue is related to the resource management. This issue involves the distribution of resources to a patient. Example, if a patient is in vegetative state, the cost of the maintenance is high, of course. At what point do you draw the line and redirect these resources to patients for whom they could be truly life-saving? How do you balance what may be perceived as a financial decision against what is an entirely personal decision to a grieving family? Yeah, if you know, yeah, vegetative state is a medical condition in which a person's brain show no more signs of activities. Next is what is ethical decision making? Namely, when faced with an ethical dilemma, the objective is to make a judgment based on well reasoned, defensible ethical principles. The risk is poor judgment. As an example, a low quality decision. A low quality decision can have a wide range of negative consequences. Here are some factors that influence the ethical decision making. First one is code for nurses, patient's right, social and cultural attitudes, science and technology, legislation, judicial decision, funding, personal, religious, and philosophic point of view. Here are some framework for ethical decision making. At least there are five. They consist of identify and clarify the ethical problems. The second one, gather data, identify options, make a decision, and the last one, act and assess. Well, everyone, here there is a case study actually related to the dilemma issue or ethical dilemma. You can read it by yourself at home and then try to understand and then just position yourself as a nurse and then give the best decision you can take based on some ethical dilemma and then the factors and then the decision making you can use that materials we have discussed just now and then try to resolve this problem. Well, everyone, I think that's all for today. If you have any questions related to the ethical dilemma, you can share your question in the room, and then we can discuss it together. That's all for today, and see you next time. Assalamualaikum warahmatullahi wabarakatuh.